Hello and welcome ladies and gentlemen to this new virtual school.
Hello everyone, Zira here. Now we are going to listen to podcast news which includes important news from India. While walking in the morning or evening, while cooking, cycling or during free time you can listen. Listening improves the quality of communication and comprehension. Before going ahead, I would like to welcome you all to the virtual school. A new way of learning and teaching, with the vision of Let's Grow Together. Our mission is to learn how to learn and teach how to teach. So stay tuned. And here we go. May 21st, 2021. Important news. Aerosols can travel up to 10 m, ventilation is the key, says government. Better air circulation is a community defense that protects all, it points out. Special correspondent, New Delhi. Aerosols can be carried in the air for up to 10 m and improving the ventilation of indoor spaces will reduce transmission, a government advisory on stopping the spread of COVID-19 said on Thursday. The advisory, issued by the Office of the Principal Scientific Advisor to the Government of India, said there was a need to remember the simple measures that could reduce the transmission of SARS-CoV-2. Ventilation can decrease the risk of transmission from one infected person to the other. Just as smells can be diluted from the air through opening windows and doors and using exhaust systems, ventilating spaces with improved directional airflow decreases the accumulated viral load in the air, reducing the risk of transmission. Ventilation is a community defense that protects all of us at home or at work, it stated. It recommended adding outdoor air in offices, homes, and public spaces. Droplets and aerosols were the key transmission modes of the virus. While droplets fell up to 2 m from an infected person, aerosols could travel up to 10 m. Ventilation in hutments could be improved by adding jalai or other simple air outlets, apart from installing exhaust fans, the advisory said. Declare mucormycosis an epidemic, Center to states it will lead to all such cases being reported to the government. Special correspondent, New Delhi. The Union government has asked the states to declare mucormycosis, the fungal infection being reported in COVID-19 patients, an epidemic. In a letter to the states, Health and Family Welfare Ministry Joint Secretary Lav Agarwal said declaring the black fungus infection seen in COVID-19 patients an epidemic would lead to health facilities screening for it and reporting all such cases to the government. A new challenge in the form of a fungal infection, namely mucormycosis, has emerged and is reported from many states amongst COVID-19 patients, especially those on steroid therapy and deranged sugar control. This infection is leading to prolonged morbidity and mortality amongst COVID-19 patients, he stated. Rajasthan, Telangana, and Tamil Nadu have declared it an epidemic. Maharashtra Health Minister Rajesh Tope said black fungus had claimed 90 lives in the state so far. 8 people had died of the infection in Haryana, which has reported 316 cases. Rajasthan has 100 patients, while Tamil Nadu has reported 9 cases. 23 more bodies recovered from barge off Mumbai. Toll rises to 49, 26 personnel still missing. Anxious wait, relatives of missing persons waiting outside a mortuary of a hospital in Mumbai on Thursday. AP. Special correspondent, New Delhi. 23 more bodies were recovered from barge P305, which sank off the Mumbai coast, taking the death toll to 49. While 26 persons are still missing as search and rescue efforts continued for the 4th day on Thursday. So far, 186 survivors have been rescued and 49 bodies recovered. INSBIOS is at Mumbai harbour, disembarking the remains, a Navy spokesperson said. Accommodation barge P305 sank 35 nautical miles off Mumbai on May 17 due to cyclone Tauktai. 3 construction barges of Afghan's infrastructure, working on a project of the Oil and Natural Gas Corporation, and 1 drilling rig of ONGC deployed for exploration off Mumbai coast were impacted. CMS humiliated at Modi's meet, Mamta. No one was allowed to speak. Shiv Sahaj Singh, Kolkata. West Bengal Chief Minister Mamta Banerjee on Thursday took strong exception to Chief Ministers allegedly not being allowed to speak at a virtual meeting with Prime Minister Narendra Modi. It was just a casual, super flop meeting. We, the CMS, felt insulted and humiliated, she told journalists at the Secretariat after the conclusion of Mr. Modi's meeting with 54 district magistrates from 10 states in the presence of their chief ministers, including Ms. Banerjee. She said she thought she would be allowed to raise issues relating to the pandemic, but was shocked at not being allowed to speak. She said she had listed several points she wanted to raise. It was one-way humiliation. No chief minister was allowed to speak. Only a few district magistrates from the BJP-ruled states were allowed to speak. Delhi HC asks hospitals to install oxygen plants. COVID-19 has left a bitter experience. Staff reporter. The Delhi High Court on Thursday asked big hospitals in the capital, with 100 or more beds, to install pressure swing absorption (PSA) oxygen plants, noting that the recent surge in COVID-19 cases had left a bitter experience for everyone due to the acute shortage of medical oxygen. A bench of Justices Vipin Sanghai and Jasmeet Singh said a lesson had to be learned, particularly by hospitals, to be prepared for future eventualities. Considering that the pandemic is once in a century and, hopefully, we will see the end of it sooner or later, we are of the view that large hospitals and nursing homes with more than 100 beds should install PSA plants having twice the capacity of normal requirements. Smaller nursing homes and hospitals having at least 50 beds and not more than 100 beds should install PSA plants/refilling to meet their normal requirements, the court said. It directed the Delhi government to take it up with the hospital owners and submit a status report by May 27. Stalin urges president to release Rajiv. Case convicts Tamil Nadu. CM says they have already spent 30 years in prison, suffered untold hardship and agony. MK Stalin R. Senthil Kumar. Special Correspondent Chennai. Tamil Nadu Chief Minister MK Stalin on Thursday wrote to President Ram Nath Kovind requesting him to accept the state government's recommendation in September 2018 and pass orders to remit the life sentences of all the 7 convicts in the Rajiv Gandhi assassination case. Mr. Stalin said the convicts S. Nalini, Murugan, Santhan, A.G. Paradivalan, Jayakumar, Robert Payas and P. Ravichandran be released immediately. DMK Member of Parliament Tr. Bailu handed over the letter from Mr. Stalin to the President's office on Thursday. In his letter, copies of which were released by the government to the media, Mr. Stalin pointed out that the convicts had spent 3 decades in prison. Prison decongestion. These 7 persons have already suffered untold hardship and agony in the past 3 decades and have paid a heavy price. There has already been an inordinate delay in the consideration of their pleas for remission. In the present circumstances of the COVID-19 pandemic, courts are also recognizing the need to decongest prisons, he said. He recalled that Nalini's original death sentence was commuted under Article 161 of the Constitution, while the Supreme Court commuted the death sentence of 3 other convicts to that of life imprisonment. The majority of the political parties in Tamil Nadu have been requesting for the remission of the remainder of their sentence and for immediate release of all the 7 convicts as they have been incarcerated for about 3 decades. It is also the will of the people of Tamil Nadu, Mr. Stalin said. State's plea to Governor. On September 9, 2018, the state government had recommended to the Governor for the remission of the rest of the sentence for all 7 convicts and their early release. The purported obstacle for exercise of the power of remission was the pendency of the investigation by the Multidisciplinary Monitoring Agency of the CBI. It has been clarified by the respective stands of the Union Government and CBI before the Supreme Court that there is no connection between the remission of the sentence and investigation, the Chief Minister pointed out. The Governor had decided that the President was the competent authority to decide on the plea of remission of sentence of these 7 persons and had forwarded the state government's recommendation to the President's office, the Chief Minister added. Government extends IT filing deadline. Special Correspondent New Delhi. The government has extended deadlines for various income tax law compliances citing the hardships being faced amid the COVID-19 pandemic. The due date for furnishing income tax returns for the assessment year 2021-22 has been extended from July 31 to September 30. Employers have also been granted a month's extension for furnishing Form 16 that reflects tax deductions at source from employees' salaries, from June 15 to July 15. Doctors felled by the virus they fight for their patients. 329 of them have succumbed to COVID-19, IMA. Call of duty. Doctors and nurses interacting with a COVID-19 patient at a hospital in Sanand, near Ahmedabad. Vijay Sonji. Special Correspondent. It is on the shoulders of these frontline workers that the bulk of the burden of fighting this pandemic falls. Doctors put themselves in harm's way to help their patients. The Indian Medical Association released its latest list on Thursday, stating that 329 doctors succumbed to the COVID-19 infection. This is probably a conservative figure, but an occasion to record the lives and work of these people, sometimes until the very last breath they drew. Gone too soon. Anas Mujahid, 26, died on May 9 within hours of being admitted to the very hospital he was serving in. The young doctor, a junior resident at Delhi's Guru Tegh Bahadur, GBT, hospital, a designated COVID-19 hospital, lost his battle to the disease. The doctor was reporting to duty till Saturday, a day before he passed away. A rapid antigen test showed that he was positive. He collapsed while still in the fever clinic and died by 2.30 a.m., said Dr. Mohammed Anas, the deceased doctor's junior at the college and hospital. He added they were told it was a rare case of rapid progression of COVID-19. Hospital records show he suffered from intracranial hemorrhage, bleeding within the skull, including the brain. Shock is an inadequate word to describe how and what we are feeling, said Dr. Mohammed Anas. He was a hard-working, humble person who kept to himself. He was known to be very polite and helpful. He is missed. Officials from the hospital administration said Dr. Mujahid, who completed his internship after MBBS in January, was working at the hospital as a junior resident and is survived by his parents, 2 brothers, and a younger sister. The thought that we lost a young soldier does hit even the bravest among us. There is a sadness that we can't ignore. But we serve because it is our only motivation, it is our purpose in life that we opted for, said Dr. Mohammed. Eminent sculptor, 2 sons succumbed to COVID-19 in a span of 12 days. Raghunath Mohapatra died at AIIMS, Bhubaneswar, on May 9. Satya Sundar Barik, Bhubaneswar. The second wave of the deadly COVID-19 pandemic continues to wreak havoc, destroying families. Days after eminent sculptor and Rajya Sabha member Raghunath Mohapatra, 77, died of COVID-19, his 2 sons lost the battle against the virus too. The sculptor, a Padma Vibhushan awardee, had 3 sons and 2 daughters. He passed away while undergoing treatment at the All India Institute of Medical Sciences, Bhubaneswar, on May 9. His second son Prasanta Mohapatra, 48, who had represented the Odisha Ranji Trophy team and was a match referee for the Board of Control for Cricket in India, succumbed to COVID-19 on Wednesday. He, too, was admitted to AIIMS, Bhubaneswar. The sculptor's eldest son Jashabanta Mohapatra, 52, who was carrying forward the family lineage in stone carving, died of COVID-19 at a private hospital here on Thursday. According to some COVID hospital sources, Jashabanta was shifted from AIIMS, Bhubaneswar, to some in a critical condition on Wednesday. 4 years ago, Susanta Mohapatra, the youngest of the 3 brothers, had died of a heart attack. Raghunath Mohapatra's mortal remains were cremated with full state honours at his Jirala village in Puri district. Prasanta's death coincided with the 11th day rituals of his late father. Don't let guard down despite dip in cases. Capital reports 3,231 fresh COVID-19 infections, 233 deaths. Staff reporter New Delhi. The capital reported 3,231 new COVID-19 cases in 24 hours and 233 deaths, according to a health bulletin released by the Delhi government on Thursday. This is the lowest number of daily new cases in about 50 days. The last time new cases were less than this was on April 1, when 2,790 cases were reported. The bulletin added that 58,744 tests were conducted with a positivity rate of 5.5%. Commenting on the fall in the number of cases that has been sustained for over 2 weeks, experts said that Delhi has passed the peak of the current wave of infection but warned that preparations need to be made for a possible 3rd wave of infection. Head of the Community Medicine Department at Safdarjung Hospital, Jugal Kishore, said that people are going to come from other cities and countries to Delhi and will bring different variants of the virus. We don't know how the virus will change and we should be careful when dealing with it. There are around 400 variants of concern and 1,000 variants of interest. Also, we don't have any studies showing lifelong immunity against the virus, Dr. Kishore said. Vaccine production. Delhi Medical Council President Arun Gupta also said that the peak is over in Delhi and that the situation is better in hospitals and admissions are also decreasing. He stressed on the importance of vaccination to combat the virus in the backdrop of the Delhi government closing down 100 vaccination centers last week due to shortage of vaccines. This is a war and all sources must be put into vaccine production. How much vaccine can two companies produce? It should be opened up for more companies and the central and state governments should work together on this, Dr. Gupta said. The ferocity of the virus has ebbed and flowed in the capital, first peaking in November after falling in the next 3 months. On January 27, the number of new COVID-19 cases had dropped to 96, the lowest in 9 months, and on February 16, dropped even further to 94. However, on February 24, the number of new cases hit 200, and started increasing thereafter. The situation that started in mid-April when people started finding it difficult to find beds in hospitals started when the positivity rate peaked at 36.2% on April 22. On Thursday, the positivity was 5.5%, the lowest since April 6. The number of vacant beds in hospitals have also increased from 5 to 6% on many days in April to 48% on Thursday. HC rebukes Centre on door-to-door vaccination. Special Correspondent Mumbai. The Bombay High Court on Thursday came down heavily on the central government for not agreeing to carry out door-to-door vaccination for the elderly and bedridden and said, "We are very disappointed by this stand." The HC had on Wednesday told the Brihanmumbai Municipal Corporation, BMC, that if the centre did not allow a door-to-door drive, the court would give the green signal. You need to chase the people to get them vaccinated. You cannot make them wait. There have been instances where people have waited for 7 to 8 hours, a bench said. Additional Solicitor General Anil Singh said prior information were given about availability of vaccines and in which centres. The court interrupted him and said, "These are for people who can come to the centres. What about those who can't come? We would like to know your advisory on that." Meanwhile, the Bombay High Court on Thursday directed the Maharashtra government to ensure that those who had got appointments to receive COVID-19 vaccine must be prioritized for inoculation. Rajiv Gandhi's assassination and the downfall of LTTE today marks the 30th anniversary of the grotesque killing of the former Prime Minister, who was believed to be on a comeback trail to power. Tragic end, Rajiv Gandhi being greeted before his address at an election rally in Sri Perumbudur, moments before he was killed by a suicide bomber. File photo. In retrospect, everyone is wise. One will, however, be never sure what destiny would have had in store for Liberation Tigers of Tamil Eelam, LTTE, Chief Vellupilla Prabhakaran had he not ordered the assassination of former Prime Minister Rajiv Gandhi. May 21, 2021, will mark the 30th anniversary of a well-planned and well-executed grotesque killing that snuffed out the life of an Indian leader believed to be on a comeback trail to power. Though the LTTE and Prabhakaran kept denying its role in the suicide bombing, the killing sealed his fate. It was Dharmalingam Siddharthan, a former Sri Lankan Tamil MP, who was among the first to realise the heavy cost Prabhakaran would pay for the killing. Esarai Sani, a bad phase of life, according to astrology, will go away for everyone after 7.5 years, Siddharthan told me long ago. I can say without hesitation that Esarai Sani gripped Prabhakaran on May 21, 1991, and it will not leave him until he dies. Looking back, Siddharthan turned out to be on the dot. None of this would have been evident to the LTTE chief when he, along with his intelligence boss Pato Aman, decided to do away with Rajiv Gandhi, fearing that he might again dispatch Indian troops to Sri Lanka. Sivarajan gets the task. Once the task of killing Gandhi was handed over to the LTTE intelligence operative known by his nom de guerre Sivarajan, the Tigers decided that the latter should not get mixed up with the existing LTTE network in Tamil Nadu. The LTTE knew that Indian security agencies were aware of almost all its activists in the state, including those working for the intelligence wing. Accordingly, one day in September 1990, a boat packed with Tamil civilians fleeing the war in Sri Lanka's northeast reached the Tamil Nadu coastal town of Rameshwaram. 2 men and a woman from the group met Indian officials and registered themselves as refugees but moved on to Chennai, saying they had friends in the city. A few days later, another boat of Tamil refugees also reached the Tamil Nadu coast. As in the first instance, 2 men and a woman registered themselves as refugees and said they, too, would prefer to live with friends in Chennai. The 2 groups rented out separate houses in Chennai, telling those who cared to ask that they were lucky to be away from the war. The 6 Sri Lankans did not know themselves, but their arrival in Tamil Nadu marked the unleashing of a deadly plot Prabhakaran had drawn up to assassinate Rajiv Gandhi. Sivarasan, known as One-Eyed Jack because of a glass prosthesis he wore in place of an eye he lost in a battle, realized soon that the men sent in advance as refugees were not enough for the tough job he had on hand. By then, 2 LTTE intelligence operatives, Nixon and Kanthan, also reached Tamil Nadu. After a brief stay in the state, Sivarasan went back to Sri Lanka and returned to Chennai in January 1991. Sacking of the Dmk government. It was the month the Indian government sacked the Dravida Munnetra Kazhagam, Dmk, government in Tamil Nadu for turning a blind eye to LTTE activities and placed the state under direct federal rule. After taking permission from Pato Aman, Sivarasan telephoned Sathasivan Krishnakumar, alias Kittu, the London-based LTTE representative, and sought introduction to a reliable Indian contact in Chennai. Sivarasan did not realize that this was a blunder. Since the June 1990 assassination of Elam People's Revolutionary Liberation Front, EPRELF, Chief K. Pathamanabha and his associates in Chennai and the easy escape of the killers, Indian security agencies had stepped up surveillance on LTTE activists in Tamil Nadu. Kittu telephoned an Indian national, Mathuraja, who was close to the Tigers, and asked him to help out a new group of LTTE members from Sri Lanka. Kittu cautioned Mathuraja against speaking to anyone about the new arrivals. Unknown to Kittu and Mathuraja, the latter was under the watch of the Intelligence Bureau. The intelligence officers were surprised by Kittu's instruction and surmised that something sinister was afoot. Even as a crackdown on the LTTE followed the sacking of the Dmk government, Mathuraja introduced Nixon to some Indians who ended up playing a key role in the assassination. Mathuraja also introduced another LTTE intelligence operative, Murugan, to an Indian family. This is when Mathuraja suddenly disappeared one day. He was being shadowed in Chennai by Indian security agencies but gave the slip one evening at Egmar. It was later learnt that he had left for Sri Lanka, ostensibly on the request of Pato Aman. Mathuraja, however, never reached Sri Lanka. His boat sank in the sea after being hit by a Sri Lankan naval vessel. Believing he died, the LTTE honoured him. But Indian security agencies believe that Mathuraja did not die. The Sri Lankan Navy took him into custody after his boat collapsed. Prabhakaran, meanwhile, asked an LTTE member, Kasi Anandan, to meet Rajiv Gandhi to convey his best wishes for the upcoming general election in India. The meeting took place in New Delhi on March 5, 1991. Some days later, a Sri Lankan Tamil banker based in London also called on Rajiv Gandhi with a message that the Tigers were eager to make up with the Indian leader. Both meetings were meant to make the Indian security brass believe that Prabhakaran was willing to bury the past and start a new chapter with New Delhi. Arrival of Thanu. Sivarasan, who had again gone back to Sri Lanka, returned to Tamil Nadu by sea early in May 1991 with Thanu, the suicide bomber. They landed in the coastal town of Vedaranyam and left for Chennai by bus. Within 10 days of their arrival, Thanu and a companion, Shubha, wrote to the LTTE leadership, "We are determined to attain our objective." By now, the Intelligence Bureau had intercepted a couple of complex, coded radio messages from Tamil Nadu to Jaffna. The IB headquarters in Delhi was pressed to break the code. One of the LTTE messages, decoded after Rajiv Gandhi was killed, was a revealing one-liner from Sivarasan to Pato Aman, "Nobody in India knows about our operation." Another explicit message, intercepted on May 7 but again deciphered after Rajiv Gandhi had been killed, was a vow by Sivarasan, "If I return to Jaffna, it will be as Pato Aman's man, having achieved the incredible feat of assassinating a world leader." Sivarasan, who pretended to be a journalist when it suited him, found out from some Congress party functionaries about Rajiv Gandhi's election rally in the small town of Sri Perumbudur, near Chennai, on May 21, 1991. A rehearsal. To ensure that everything went well, the LTTE had carried out a rehearsal at an election rally of former Prime Minister VP Singh in Chennai. As Singh was leaving, Thanu walked up to him and touched his feet as a mark of respect for an elder. The whole exercise was recorded on video and viewed by the LTTE many times to check if there were any flaws. Clearly, there were none. On May 20, 1991, the LTTE Killer Squad watched a Tamil movie at a cinema hall in Chennai. The next evening, the group proceeded to Sriperumbudur and was met by a young Indian photographer, Hari Babu, who had no clue about the planned assassination. At the rally, Thanu was armed with a sandalwood garland and a deadly suicide vest which was hidden by a loose-fitting bright orange salwar kameez. When a policewoman tried to question Thanu after seeing her near the VIP enclosure, Hari Babu intervened to say she would garland Rajiv Gandhi. Sivarasan, dressed in a white kurta pajama, stood near the dais. Eventually, when Rajiv Gandhi made his way towards a waiting crowd, Thanu moved close to him. The same policewoman tried to push her back. But he stopped her and remarked, "Let everybody get a chance." Thanu put the garland around him and bent down as if to touch his feet. But she never got up. She switched on the toggle switch attached to her suicide vest, triggering a terrible blast that ripped through her, Rajiv Gandhi and 16 others. The author is a Sri Lanka watcher and has written a biography of LTTE chief Thalupala Prabhakaran. China completes Tibet Highway. It enables greater access to remote areas along disputed border with Arunachal Pradesh. Strategic link, a file photo of the Yarlung-Zangbo River's Grand Canyon, through which the highway passes. AFP. Ananth Krishnan. China has completed the construction of a strategically significant highway through the world's deepest canyon in Tibet along the Brahmaputra River, enabling greater access to remote areas along the disputed border with Arunachal Pradesh in India. The highway, official media in China reported this week, took 7 years to complete and passes through the Grand Canyon of the Yarlung-Zangbo River, as the Brahmaputra is called in Tibet. This is the second significant passageway to Medog County that borders Arunachal, the official Xinhua news agency reported, directly connecting the Pad township in Nyingchi to Baibung in Medog County. The highway will reduce the distance between Nyingchi city and Medog from 346 kilometers to 180 kilometers and will cut the travel time by 8 hours. The project, undertaken by the China Huaninge Group, required an estimated investment of over 2 billion yuan, around $310 million, Xinhua reported. The construction, which began in 2014, is part of a wider infrastructure push in border areas in Tibet. In November, China began work on a strategically important railway line, its second major rail link to Tibet after the Qinghai-Tibet Railway that opened in 2006 that will link Sichuan province with Nyingchi. That project was considered important enough for President Xi Jinping to officially launch it, as he called it a major step in safeguarding national unity and a significant move in promoting economic and social development of the western region. Zhu Weikan, a senior party official formerly in charge of Tibet policy, was quoted as saying by state media that the railway will help transport advanced equipment and technologies from the rest of China to Tibet and bring local products out. He said, "If a scenario of a crisis happens at the border, the railway can act as a fast track for the delivery of strategic materials." The first segment of the line within the Sichuan province, from Chengdu to Yan, was completed in December 2018. Work on the 1,011 km section from Yan to Nyingchi will be finished in 2030. Civilian settlements. Another part of the border infrastructure push is the construction of new civilian settlements, along with the expansion of existing smaller hamlets, along border areas, some of which lie in disputed territories claimed by India and Bhutan, to strengthen China's control over the land. In 2017, the Tibet Autonomous Region, TAR, government launched a plan to build moderately well-off villages in border areas, under which 628 first-line and second-line villages, referring to those right on the border and others in remote areas slightly further within, would be developed in the prefectures of Engari, Shigatse, Shannon, and Nyingchi, along China's borders with India, Bhutan, and Nepal. An investment of 30.1 billion yuan, about 30,000 Indian rupees crore, was announced for the project, covering 62,160 households and 2.4 lakh people, and includes plans to resettle residents to live in the new settlements. Last year, satellite images emerged showing a new village called Pangda built 2 to 3 kilometers into what Bhutan sees as its land. On January 18 this year, another village built 4 to 5 kilometers into what India sees as its territory in Arunachal was seen via satellite images. Indian officials said this land has been under China's effective control since 1959 and there were military barracks there earlier. The civilian settlements, along with the new infrastructure connectivity, are seen as aimed at bolstering China's control over the areas. Sonia for free education to those orphaned in pandemic. They are left with the trauma of loss and no support. Sonia Gandhi. Special Correspondent, New Delhi. Congress President Sonia Gandhi has urged Prime Minister Narendra Modi to provide free education in Navodaya Vidyalayas to the children whose parents died of COVID-19. In a letter to Mr. Modi on Thursday, she highlighted the plight of the children who either lost both the parents or an earning parent during the pandemic. They were left with the trauma of loss and no support towards a stable education or future, she pointed out. Amid the devastation caused by the pandemic and the heart-wrenching tragedies being faced by affected families, news of young children losing one or both parents to COVID-19 are the most poignant, she said. I am writing to request you to consider providing free education at the Navodaya Vidyalayas to the children who have lost either both parents or an earning parent on account the COVID-19 pandemic. Feel that as a nation, we owe it to them to give them hope for a robust future after the unimaginable tragedy that has befallen them, she wrote. The Navodaya Vidyalayas are CBSE-affiliated co-educational residential schools in which talented students of class 6 to 12, after clearing a selection test, are offered free education, including textbooks, school uniforms, and hostel facilities. Ms. Gandhi described the Navodaya Vidyalayas among the most significant legacies of her husband, Rajiv Gandhi, and noted that there were as many as 661 such schools across the country. It was his dream, Rajiv Gandhi, to make high-quality modern education accessible and affordable to talented youth, predominantly from rural areas, she stated. Jaishankar may meet U.S. vaccine makers minister likely to travel next week. S. Jaishankar. Suhasini Haidar, New Delhi. As the government gears up to tackle the growing vaccine shortage, External Affairs Minister S. Jaishankar is expected to travel to the U.S. next week to discuss procurement with American companies. Mr. Jaishankar is expected to meet U.S. officials and executives from Pfizer, Moderna, and Johnson & Johnson in Washington and New York, sources told The Hindu. The minister's discussions with the vaccine manufacturers are expected to focus on the availability of doses in India at the earliest. The External Affairs Ministry did not confirm Mr. Jaishankar's dates for travel to the U.S., which would be his first such visit since U.S. President Joseph Biden assumed office. We remain engaged with U.S. entities on the prospects of procuring vaccines from the U.S. and also perhaps manufacturing them in India subsequently. This would augment our vaccine availability, Ministry spokesperson Arindam Bagchi said at a press briefing on Thursday. I would like to emphasize that all vaccines that may be procured from abroad would need to be as per our regulatory guidelines. I understand that the U.S. has also indicated that any vaccine that it sends abroad would be after obtaining FDA Food and Drug Agency clearance for product quality, Mr. Bagchi said, referring to possible delays in the release of AstraZeneca doses given that the FDA is still carrying out what the U.S. State Department called a review of all doses made at the plant where AstraZeneca doses were produced. According to the sources, India continues to worry about the U.S. strictures on the export of vaccine ingredients or raw materials needed for manufacturing in India under its Defense Production Act. That is still an issue despite the Biden administration's decision last month to divert some of its orders towards India. In a tweet on May 5, U.S. Chargé d'Affaires Daniel Smith had announced the arrival of vaccine components that would enable the manufacturing of 20 million doses of the Covishield vaccine at the Pune-based Serum Institute of India. However, according to officials, the DPA-driven restrictions will